Hey everyone, how's it going? This is Max from Unsubscribed Healthcare, and today I want to go over the CMS Input Tab. And what this tab is basically doing is that it's filling out this CMS insurance claim form for you and pulling forward all the patient information to fill out the spots so that you don't need to do this each time. This is what the CMS 1500 form looks like blank, and it is widely accepted by multiple insurances. This is the Max Shippin CMS Input tab. Here we will need to place where we're seeing the patient. Then we also need to determine what the insurance plan is marked as. Do we have the signature on file for both the patient and the person under the physician? And then after that, in rows 10 all the way down to 54, is going to be dealing with the CPT codes. So when you put in for your evaluation, you'll be able to put that in here. You want to make sure that your evaluation is done at this point. And if we were treating lower back pain, we would have the treatment diagnosis code here. That's important for later on when we go for the diagnosis pointer. Since we only have one diagnosis pointer, we'll put it on A. I'm not going to tell you guys how to fill out the CMS 1500 form. If you guys are looking for a great person to learn from, I would suggest taking Anthony Maritato's class, where he'll teach you how to fill out the form. He has a couple of videos on YouTube as well, but you can watch those videos and you'll be able to fill out this form out correctly. When filling out the CPT codes, you can click over here on column G, and you'll be able to select the same data services to and from, as well as the modifiers, diagnosis pointers, ID qualifiers, and the same provider. The reason that you're not seeing them in all of them is because the program works by waiting until you select a CPT code. Then it pulls all of that information forward. The things that it doesn't pull forward are the charges and units, because I want you to make sure that you're going to be putting those in yourself. I'm just going to do those 4 codes for right now. Amount paid, we can say $40 is what they paid at the eval. Sometimes you'll see that it doesn't format correctly. To make sure it formats next time correctly, you can come up here to the paint bucket and just click reset. And then next time we delete the number, yep, it goes back to red. And that's what we want to see. After row 54, we're going to get into the description in column B, the input in column C, and again, description in column E, and input again in column F. In column G, you can see an image that has been placed there in order to help orientate you to the CMS 1500 form, which I showed at the beginning of this video. The areas that are in red aren't areas that are formatted, so if you determine that they are needed or that they are beneficial or required for your patient and the CMS form you are trying to build, you can fill those in. If you determine that they're not needed, you don't need to fill them in. I'm not filling in section 9 because you can see that the patient put in that they are self-insured. If you guys are questioning how to fill this out as well, or what the standard is, this is directly from cms.gov. You can click on that and see the Medicare Claims Processing Manual. Okay, when you filled it in and you're satisfied with how it looks, you can click on the Save Grid or Save No Grid options. These 2 buttons will do save one of 2 things. They can either save with the grid behind it using the template that is in your package as well, the CMS Color 2.0. It takes the placeholders and replaces them in this Google slide. So if we click on Save with Grid, you can see what that looks like. Now we can click on that hyperlink that is presented and see what it looks like. It looks good. All of the boxes are checked off. All of the numbers align properly. So you could print this out and you could give this to your patient for them to try and submit for reimbursement. It's best to not use this to try and accept assignment. What I would recommend is getting a pre-printed form and then clicking Save with No Grid. When you click Save with No Grid, you're going to see a PDF appear as well. And when you print this, it should fill in exactly as needed into the CMS 1500 form. You can see here is a little bit off, and here is a little bit off for the 11 and the 97161. If you needed to fix those, I'm going to make sure that they're all fixed before this is released. But for whatever reason, if you need to fix them, you would go up to the hidden sheet and click on the CMS 1500 form. And you can see here, it's not aligned properly. It's in the middle. It should be on the left. And then same thing with this number. It's in the middle. It should be on the left. And now those all look lined up. So we'll hide this again, the sheet. I'm going to go back to the CMS input form and click Save No Grid. Now when I click on this PDF, you can see that everything is lined up and it looks great. So this is an overview of the CMS input form. If I was going to create a new CMS 1500 form for the second treatment, now all I would have to do is update the dates of service, the codes that I desire, and the charges. And that way I'm able to really just quickly go through this and create that CMS 1500 form. Up next, we will be going over the super bill.